Welcome to Neurovision's virtual in-service for the Cobra 3 EMG monitoring endotracheal tube. Neurovision produces Cobra tubes in sizes 6, 7, and 8 mm interior diameters. These sizes are prominently displayed on the ends of the boxes. After anesthesia has opened the package, the green and white needle electrodes should be set aside for the surgeon or their assistant to apply after intubation. Neurovision strongly recommends using a glide scope, CMAC, or similar laryngoscope to visualize the intubation for optimal electrode positioning at the vocalis muscles. The Cobra's 73 mm long recording surfaces provide ample leeway during positioning. The vocalis muscles should initially sit approximately mid-length on the silver electrodes to account for tube extension or retraction during patient positioning. Before the balloon has been inflated, and once again as the Cobra is being taped at the mouth, please note the dark line marking the posterior aspect of the tube. This mark should be aligned toward the patient's upper incisors. If the tube cannot be secured midline, the dark line must still be oriented toward the upper teeth. This dark line indicates the laterality of the electrodes at the muscles. Whether using an elbow or straight coupler, the junction from the ventilator system will apply torque to the tube and may potentially turn the electrodes away from the muscles. This likelihood is greatly reduced when corrected early on, and thus it is highly beneficial to verify the orientation of this mark once more just prior to draping. Neurovision further suggests supporting the Cobra to mitigate kinking, using perhaps a Christmas tree, bite block, or foam pad on the forehead. Finally, to connect the electrodes to the NIM3 patient interface box, simply follow the standard color pattern. Plug the red, blue, green, and white DIN connectors into their respective ports. If being used on an EMG system without color guides, note that blue is left, red is right, green the EMG ground, and white the stim return. The blue-white and red-white wires both lead to and share the single posterior plate as channel reference. Neurovision strives to provide safe and reliable EMG monitoring throughout your procedure. If you have a question at any time, particularly before or during the procedure, please call our clinical support line at 866-815-6999. Select option 1. For less urgent questions, choose 2 instead to consult customer service. Clinical support is provided 24 hours a day, 365 days of the year. Thank you, and stay well.